Childhood illnesses, identification and management. Early signs of illness. Teachers should become familiar with signs that are characteristic of common childhood communicable illnesses. Recognizing the early signs provides an effective method for limiting the spread of communicable illnesses to other children and adults. Airborne transmitted illnesses. What signs do each of these illnesses present, and how can the illness be controlled? Common illnesses include chickenpox, colds, fifth disease, HIV, measles, and meningitis. Mononucleosis, mumps, rosella, strep throat, tuberculosis, and whooping cough. Airborne transmitted illnesses prevention. Recognize the sign of the illnesses and isolate the child to prevent spread of the illness. Proper hand washing will prevent the spread of most illnesses. Blood-borne transmitted illnesses. What signs do each of these illnesses present, and how can these illnesses be controlled? Common illnesses include human immune deficiency virus or HIV, acquired immune deficiency syndrome, AIDS, hepatitis B. Blood-borne transmitted illnesses prevention. Use universal precautions with all children and treat all blood as contaminated blood. Proper handling of bodily fluids prevent the spread of blood-borne illnesses. Proper hand washing will prevent the spread of most illnesses. Contact transmitted illnesses. What signs do each of these illnesses present, and how can these illnesses be controlled? Common illnesses include pink eye, hand-foot-mouth disease, herpes simplex, impetigo, and head lice. Ringworm, Rocky Mountain spotted fever, scabies, and tetanus. Contact transmitted illnesses prevention. Recognize the signs of these illnesses and isolate the child. Fecal oral transmitted illnesses. What signs do each of these illnesses present, and how can the illness be controlled? Common illnesses include shingleosis, hepatitis A, E. coli, pinworms, encephalitis, and salmonella. Fecal oral transmitted illnesses prevention. It is extremely important that you wash your hands after using the restroom or changing diapers. Children must wash their hands after using the restroom and before all meals. Proper hand washing will prevent the spread of most illnesses. Diarrhea. It is important to distinguish between non-infectious and infectious causes of diarrhea. Diarrhea can be a serious condition in infants and toddlers, especially if it is excessive or prolonged. Earaches. Earaches are common, especially in boys younger than age 3 or 4. Earaches are often associated with allergies, colds, feeding position in infants, and/or foreign objects in the ear. Lyme disease. Lyme disease is a tick-borne infection that is becoming increasingly more common in the United States and Canada. Prevention is the best method of defense, so wear protective clothing, use insecticide repellents, bathing and inspecting the skin after playing outdoors, and remove tick. Consider this. Why might some families knowingly bring an ill child to school? How should teachers address these types of situations, especially if it's a recurring problem? The best thing to do is to have the family advocate talk to the family.